I am so excited about our very special guest today. We are going to learn something really super, incredibly important when it comes to dealing with your health, wellness, and medical bills. At the end of this episode, you're going to learn exactly what to do when you get a medical bill that you know is completely wrong, just not right, just downright bogus. But the provider's billing department is giving you the runaround. Today, we're going to become masters at how to get the media to help with your bogus medical bill with Marshall Allen. Marshall Allen is the author of Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win. He's also the founder of the Allen Health Academy, which teaches individuals and employers to become empowered and get better value for their healthcare dollars. Marshall was a healthcare reporter for ProPublica, an independent, nonprofit, investigative journalism newsroom for a decade, which is where I discovered his outstanding work. Marshall Allen, thank you so much for joining us. I feel so honored you took the time to share your years of hard-earned insights. Thank you so much for being with us.
It's my pleasure to be here with you, Virgie.
So can you talk about, Marshall, how did you come to do this really critically important but little known work to teach people how to protect themselves from becoming American medical predatory billing victims, basically cost victims of the American medical care system?
Well, it started, Virgie, by talking to hundreds of patients who have been really steamrolled by our medical system. If you look now at the latest statistics, they say that 100 million Americans has medical debt right now, and about 1 out of every 5 has medical debt in collections. I mean, that is just an astounding number. So if it hasn't happened directly to you or your family, it has certainly happened to your friends and your other loved ones. This is like the pandemic. It's this affliction that's happening to every working American. Because even if you can afford your bills, you're overpaying for them. You're paying too much. And so I have written over the decades as a journalist so many stories, certainly in the hundreds of stories, about patients who have either been physically or financially harmed by our healthcare system.
Or both?
I've documented these stories. I've gotten their bills. I've gotten their medical records. I've had experts look at them. So I learned a lot through this process. And I said, okay, I want to put this together in a book that's like a handbook for patients to navigate the system and fight back and win. And by win, I mean get your healthcare, get the healthcare you need for a much, much lower price.
So, I have to tell you, when people think about health care, medical care, health insurance, paying for medical care, our eyes kind of glaze over.
Yes.
And, literally, I know I'm preaching to the choir.
Yeah.
But tell me, how did you come to do this work? Because that's not your background.
Well, I came into it as a journalist, but before I became a journalist, I actually worked in a full-time industry for 5 years. And so I really started off my career in the business of really helping people with their deepest needs. In that case, it might have been spiritual needs, right? But as I became a journalist, I saw that this healthcare system is really causing a lot of harm to the public. And it's not a legal issue. I mean, a lot of the things that you see happening in healthcare are legal, but it's moral and it's ethical. And so I came into this
immoral and unethical.
Yes, exactly. Yeah. And so I came into this as a person of faith. I'm a Christian. And so I view the world through this biblical lens, right? And by that, I mean, I believe that, if you look at the golden rule, it says that we should treat others as we want to be treated. I mean, those are the words of Jesus in the book of Matthew. Well, our healthcare system is not doing that. It promotes itself as this healing industry, and it is. And in the best instances, we see clinicians saving people's lives, right? So it is doing that on the clinical side. But on the business side, it is this nefarious business, actually, that is using a lot of deceptive schemes to take advantage of people's sickness to make profits. And it becomes, at a certain point, making a profit is okay, but profiteering off of people's sickness, that's not ethical and that's not moral behavior. And so my ministry and kind of my Christian worldview was being applied to looking at the healthcare system and seeing all of this harm and all of this unethical behavior. And it was really perfect for me as an investigative reporter, because as an investigative journalist, you just dig into that stuff and you kind of like grab onto it like a dog with a bone and you don't let it go. And so digging into these issues, I found a lot of interest there, but a lot of it for me is that moral interest, right? And I see people being wronged. I see injustices being done. And so it makes me want to do something about it.
So are you saying that you were a journalist at the same time you were in the ministry?
No, I
How
actually
did
did
that
full-time
happen? What was the
ministry first.
timeline?
Yeah, so I came out of college, I got a degree in English. And then my wife actually grew up overseas. She was a missionary kid and she wanted to do something internationally. And so we ended up going to Kenya for 3 years and doing youth ministry. And then after that, I came back, I went to seminary. So I had a master's degree in theology. And I actually thought I would continue in full-time ministry. But then I started freelance writing, and the freelance writing really gave me the journalism bug. And that's what then led me into full-time media work back in 2001.
And that's when you joined ProPublica.
No, I joined ProPublica in 2011. So before I was at ProPublica, I was at a newspaper in Las Vegas called the Las Vegas Sun for 5 years. And that's where I started covering healthcare. And then before that, I was a journalist in Los Angeles for 5 years, not covering healthcare, but writing about lots of different things.
So when you were in Nevada,
yeah,
right? And you said, okay, I'm joining this paper. Did you say, okay, I'm going to be their healthcare journalist? I'm going to be
No, not at all. Not at all. In fact, quite the opposite. I didn't have an assigned beat when I got there. I was just doing investigative and kind of feature stories. And one day the editor invited me out to lunch and they said, "Hey, Marshall, we'd like you to cover the healthcare beat." And my first words, no joke, were, "I can't imagine anything more boring than writing about healthcare." And so I can relate. I get it. I know people don't want to think about this subject. I know that it makes people's eyes glaze over, because when I was invited to cover it and assigned to cover it, I actually thought it would be totally boring myself. And I quickly found out that it's very interesting, because I write about healthcare from the point of view of the patient. And so the patients are being harmed by poor quality healthcare. They're being bankrupted by unreasonably high cost healthcare. And so I would write stories from that point of view, which made the stories very engaging to readers. But I get it. I get it. People don't want to think about their healthcare costs, and they don't want to think about what they can do. We've been conditioned to trust the healthcare system, but then we've been burned over and over again. And so I like to tell people that thinking about your healthcare costs and engaging on your healthcare costs is a bit like how we have to monitor our checkbook or our credit card statement. You don't want to do that either. I mean, who wants to look at their credit card statement every month and make sure it's accurate? But you know that if you don't do that, you could have charges on your credit card for hundreds or even thousands of dollars that you didn't even expect, or that are erroneous charges even. And so you have to check it. And in the same way, your medical bills could be hundreds or thousands of dollars higher than they should be, because maybe you went to the wrong place for your service, or maybe there's an error on the bill, or maybe the charge is just 5 times higher than it should be. And if you know how to check that, you can contest it, and you can save hundreds or even thousands of dollars on each medical encounter. So I tell people, like, think of this like financial wellness or your financial health. Think about this more like a consumer finance perspective, instead of just a boring healthcare perspective. I mean, this is big money at stake here. And so people have got to get engaged. They've got to be educated. They've got to be empowered. And that's what I'm doing. And that's what I love about what you're doing, Virgie. That's what you're doing with your work too. And so we can build up a movement of empowered consumers, and they can save money. And I also believe, Virgie, they can change our healthcare system. I mean,
Yes.
imagine if every single patient demanded an itemized bill with the billing codes. Imagine that. Well, the billing departments because of the hassle, they would just start providing them. Or I have a chapter in my book about how to sue in small claims court if you're getting ripped off. Small claims court is a great venue. Imagine if every time someone got a surprise out of network bill, they got hit with a lawsuit from that patient in small claims court. Now they got to pay lawyers' fees. Now they got to show up in front of a judge and be held accountable for what they're doing. They don't want to do that. So we don't need every consumer to do this. We just need even a small group of consumers to stand up and say, what's happening is not right, and I'm going to do something about it.
Excellent point. Thank you. Yeah, my mother used to say, you know what? We're part of the Mutual Admiration Society. And I have to tell you, you're my hero. When I saw you were doing this work, I didn't realize that you had already left ProPublica, I think, by the time I discovered your work, because I didn't start doing this work, as I tell people, until I became a patient and found out what was going on the other side of, being a provider and being on the payer side. And so I discovered your work when you were still with ProPublica, and that's what got me supporting ProPublica every month. I thought,
That's
oh my
great.
gosh, this is awesome stuff. So, you know what? Just thank you so much for what you do. And we're going to talk a little bit more about when and how to get the media involved. But you said something, Marshall. You said, you know what? There are times when you end up going to the wrong place to get care.
Yes.
Can you talk about that?
Yeah, I mean, so it's amazing because no one teaches health literacy in this country. No one
That's
teaches
right.
anyone how to navigate the healthcare system.
That's right.
So if you get, let's say you're doing in fact, my nephew, this just happened to him. He does home remodeling. He was taking out a window from a home, and he sliced a big, pretty sizable gash in his thumb. Well, most people, and he said this himself, initially he thought, well, I need to go to the emergency room and get that fixed. Well, the emergency room at a hospital is the most expensive place you can go to get healthcare. And something like a cut on your thumb, you can get easily taken care of at an urgent care center or even a doctor's office. And so he had read my book, and he learned that he should go avoid the emergency room whenever you can. So he went to an urgent care near him. He paid cash. The price was reasonable. It was a couple $100s. They stitched up his thumb. And he did the other thing that I recommend, and I know you also recommend. He asked for a discount. He said, hey, I'm paying cash right now on the spot. Can you give me a discount on that? And they gave him a sizable discount. And so he saved a lot of money. He paid cash up front by avoiding the emergency room. And so that's just a very basic tip. Anybody in healthcare knows that is basic 101 health literacy knowledge. But a lot of the public doesn't know that because they've never had it explained to them. I'll give you another example. Let's say you go to your doctor and he says, I need you to get an MRI or a CT scan. And so he writes an order for you to go down to the local hospital and get your MRI or your imaging center. Well, it's not an emergency situation. And so patients don't know this, but hospitals will charge exponentially more for an MRI or a CT scan compared to an independent imaging center. And this is also true for lab tests. So if you go to a hospital affiliated imaging center, you might pay $2,500 for an MRI or a CT scan. If you go get it done at an independent imaging center, you might pay $300 or $400 or $500 for the exact same image, same quality. It's exactly what you need. You're not compromising the care you need, but you're paying about an eighth or a tenth as much by going to an independent place. Nobody ever teaches you that. So you actually have to learn that. But if you know some of these basic things, some of these principles and some of these tactics, you can save hundreds or thousands of dollars per healthcare encounter.
And sometimes hundreds of thousands of dollars.
Oh, yeah.
Definitely over the lifetime, your lifetime and that of your loved ones.
Definitely.
So, Marshall, when should we get the media involved? At what point should we say, you know what, I'm tired. This isn't right. And I just can't beat my head against the wall anymore. What do we do? At what point do we say, when is it time to get the media involved?
Well, so I like to say that my book and my health literacy videos, or your book even, we're helping people help themselves. And to a certain degree, people can do that. And often it's way easier than you think. But sometimes the cases are super complicated, or sometimes the cases are maybe the patient is sick or unable to, do kind of, they don't have the energy or the initiative to address some of these issues because it does take persistence. In those cases, I do recommend that people try and reach out to a reporter. Again, there are caveats here. You have to be willing to tell your story. You need to be willing to tell it out in the open, out in public. But if you can get the attention of a journalist, I often see that when the journalist calls, the hospital or the doctor's office or the dentist's office or the insurance company, they quickly fix that problem because they know there's going to be that public accountability for it.
Yeah, in my experience, I tell folks this all the time. The providers and payers, meaning the health insurance companies, really do not like bad PR, negative PR.
They don't. In fact, sometimes, Virgie, I think they're more concerned with the image that they project than they are about the reality of what they actually do. And I saw that scores of times as a journalist, where I would be telling a patient story. I would call before the story published, they would have that thing fixed. And of course, I would put it in the story that they fixed it then. So that's good. But the problem is, I wish it didn't work that way, but it often does. There are some key things to keep in mind. I'll give you some tactics about how to approach a reporter. I definitely recommend following the guidelines I lay out in my book and also my health literacy videos. And I'll mention those in just a minute, to make sure that you really understand your own case. If you can get that itemized bill and you can show that you're being overcharged for something, and if you've gotten your medical records and then the medical records verify what you're telling the reporter, that's going to help a lot, because you're going to send an email to a reporter that's a summary, a short summary, maybe a page or two at the most, that's going to describe what's happened to you. And then you're going to attach maybe your itemized medical bill, or maybe a key section of your medical records. That way they can see, oh, this patient has done their homework. This patient is verifying to me through independent documents that what they're saying is true. And so that will really go a long way toward helping give the patient credibility in the eyes of the reporter. And then the other key thing is make sure you approach the right reporter. So I definitely recommend looking for reporters who've done these kinds of stories in the past. So if you look at Kaiser Health News right now, they do a Bill of the Month series. It's like a feature that they do. Well, of course, submit it to them. Now, their problem is they're probably getting too many bills of the month. So if you're local, go to a local journalist or a consumer watchdog type of reporter. These folks are on TV, they're on the radio, they work for newspapers or websites, but they love to do these kinds of stories. But they want to make sure that you're credible and that you're willing to go on the record. So when you approach them, you just want to approach them in the right way.
So why would someone say that they don't want their name mentioned, or they don't want to be, quote unquote, on the record?
Well, some people are private. So, I totally respect that. Some people just don't want their name out there in public. It's also dealing with private things like medical conditions that they might not want to have out in the public.
Sure.
Other times, though, people might just be afraid of being blackballed by their doctor or by their hospital or by their insurance company. It's definitely creating a conflict high environment when the patient tells the story out in public. So it's not ideal or possible for every patient, but under certain conditions and circumstances, it really is very effective.
So you said, start local. If you have, unfortunately, our local newspapers are dying, the industry is dying, and that may have been a place to start locally. And you mentioned the national public online source, Kaiser Health News, KHN.org. And they've been doing this for the past year or so, collecting medical bills from folks all over the country. So, okay, maybe you want to start, as you mentioned, local. I find the local news reporters, TV news reporters, those are the ones that really can get things started locally.
Oh, yeah.
You're more likely to have a help me kind of, for lack of a better description, a kind of help me Hank kind of
Yes.
reporter kind of thing.
Yes. And in fact, maybe counterintuitively, it might be better to go local because the healthcare provider, that's their local market. And the other advantage with a local journalist is that they can also follow up on the story. So if something gets corrected down the road or not corrected, they might be interested in doing a follow-up story, whereas a national reporter is probably not going to do a follow-up.
Oh, good point. So, Marshall, where can we find you, your book? Again, Never Pay the First Bill, and more information about the Allen Health Academy?
Well, so I want to mention and be sure to mention my health literacy videos. I call them the Never Pay Pathway because they're based on my book, Never Pay the First Bill. And those are a resource that takes the information in my book and these same tactics that we've talked about today. I've broken all this down into 16 really engaging short videos so that people can watch the videos and learn the content by watching it instead of needing to read a book. And you can check those out at allenhealthacademy.com. And it's Allen, ALLEN, healthacademy.com. And I also have a scholarship program available there. So if anybody has limited income, you can take advantage of that scholarship I have right there at checkout. And you can either pay a reduced price or just pay what you want. I mean, I really want to get this in the hands of people. And then the other thing I want to let people know about is my newsletter. And my newsletter can be found at marshallallen.substack.com. And that's a free health literacy newsletter where every 2 weeks I tell what I call victory stories. And these are just the stories of people learning these tactics and applying them and saving lots of money on their healthcare. And I do invite people to become paid donors to that newsletter. And what I do with those donations is I use those funds to hire patient advocates to help patients in need. So again, if you want to be a paid subscriber, you can, but that's not required at all. It's free. So sign up for free at least, and please share that so that more people, we're trying to build a movement here, Virgie, right?
Absolutely. Say it again.
Yeah, we're trying, and there is a movement that's growing. I think that's what's exciting. There is a lot of momentum that's building right now. And so we need to just overcome this inertia, this idea that we can't do anything about this, because a lot of us really can do a lot about it.
That's right. Awesome work. Thank you for all you do, Marshall. Thank you, thank you, thank you for everything, all that you do. And you've been doing for at least the past decade that I know of. And again, it's much, much appreciated.
Thank you, Virgie. It's just an honor to be here with you.